Thank you for having interest in my Vital View's robust patient engagement and monitoring platform. We are very excited to share our business model with you and look forward to answering any questions you may have after the presentation. Thank you in advance for your consideration. Utilizing my Vital View's patient engagement platform, you will be able to perform remote patient monitoring, chronic care management, as well as telehealth services for your patients, all through a HIPAA-compliant and secure platform. My Vital View has developed an information platform that receives and responds to your patients' biometric data. Each service has a multiple microservice architecture, where each component is a standalone, but linked together creates an orchestration service layer. There are internal analytics to ensure functionality and durability through proprietary algorithmic logic, retry logic, queuing with constant monitoring and reporting. My Vital View's advanced software enables providers to easily implement a robust remote patient monitoring and chronic condition management program. The benefits of remote care programs for clinicians include complete transparency to patient data, tools and artificial intelligence to better manage chronic conditions, as well as reduce complications and expenditures, while experiencing an increase in revenues through monthly reimbursements for your efforts. The longer the members are enrolled in remote care management programs, the greater everyone benefits, including patients, providers, and health plans. Including all expenses from inpatient hospital, skilled nursing, home health, hospice, durable medical equipment, outpatient, and professional services, the total Medicare expenditures was decreased by an average of $74 per member per month, equating to an annual healthcare savings of $888 per member for participating in remote care management programs. Providers want to have unrestricted access to their patients' vitals and be notified if they were trending negatively or experienced an acute episodic event, but it's got to be the right model. Most RPM companies offer a model that involves the provider performing most of the work, as well as signing a license agreement and committing to purchasing devices. Both present an ongoing liability to the provider in respect to having to implement new processes and protocols, as well as paying monthly subscription fees and being responsible for managing devices. Most providers will be reluctant to move forward with a business model where they have such administrative responsibilities. Instead, we designed our business model to be turnkey, where we carry the heavy load and leave the light load for the provider. Providers today are being faced with increased demands from MIPS reporting, GAPS measures, reduction in readmissions, and more. Some are struggling to keep up with the increased demands based on their current staff, let alone trying to implement something new, even if the program will ultimately help their efforts. By offering programs and the ability to outsource any or all aspects allows every provider the opportunity to participate no matter their size or strength of staff. My Vital View offers providers the ability to outsource every component, from clinical interventions to billing claim submissions. This allows the providers to grow as quickly as they want without the typical constraints of upfront financing for the devices or increasing their staff for the clinical demand. Both programs provide monthly reimbursements for time spent by clinical staff. The primary professional component code for chronic care management is 99490 and has an allowed reimbursement of $64 per month. The primary professional component code for remote patient monitoring is 99457 and has an allowed reimbursement of over $50 per month. Combined, both programs provide a total professional component monthly reimbursement of over $100 per patient per month. My Vital View can handle all of the administrative aspects of the care management program and typically receives exclusive compensation through billing the technical component CPT code 99454. The following administrative services are available at no additional cost to help reduce the burden of implementing an RPM program. My Vital View will perform an outbound campaign to qualified patients for education and confirmation of participation. Remit a secure email to provider with a list of all patients that verbally consented to participate with the program. Create a digital patient profile and ship devices with a personal stop light action plan within 24 to 48 hours of receiving executed RPM referral order. Attach a personalized digital care plan based on conditions to be managed by provider and assign patients to appropriate care managers. Provide real-time alerts to providers, clinical staff members, family members, anyone the patient provides authorization at no additional charge. Provide a white glove service for patient device setup. All devices are ready for use and connectivity straight out of the box. Batteries are pre-installed and devices are already associated with the patient's profile. No pairing and additional setup needed by patients. Perform a welcome call to each patient that includes additional education and confirmation of the patient's initial successful upload of vitals. Our patient advocate team follows the patient and manages their adherence related to their prescribed testing rate. The patient advocate team also handles all technical and device issues on behalf of the provider. At the end of the month, My Vital View will review each patient's chart and confirm billing requirements. The My Vital View dashboard calculates all activities performed within the month and populates the appropriate CPT codes for billing. Wireless FDA-approved diagnostic devices are provided to each patient based on condition managed. My Vital View offers blood pressure monitors, weight scales, pulse oximeters, blood glucose monitors and testing supplies and more. My Vital View also has an integration with Dexcom for their continuous glucose monitoring system and manual entry of data from Zoe monitors and capnography devices. For patients that do not have a smart device or Wi-Fi at their house, we offer cellular devices including blood pressure and weight scales. We have found that over 89% of our patients have some connectivity currently, but we have device solutions for patients that do not. My Vital View is in process of contracting with the Florida HIE for ADT and ENS real-time notifications if any My Vital View patient has an admission, discharge, or transfer. Remote Patient Monitoring Program Requirements. In order for a patient to participate, they simply need to have at least one chronic condition and provide a verbal consent. My Vital View makes it convenient and easy to stay connected in between office visits. Provide FDA wireless devices to your patients. Have unlimited access to your patient's vitals with notifications and alerts, while increasing your MIPS and HEDIS measurements. My Vital View wants to partner with your organization to help you implement a robust remote patient monitoring and chronic condition management program for your patients. As detailed in the presentation, My Vital View handles all of the administrative aspects of enrolling, educating, and managing your patient's adherence with the programs. Sign up today and let My Vital View send wireless diagnostic devices to all of your qualified patients, so you can start managing their vitals remotely while earning over $100 per patient per month. Thank you for your time and consideration. We look forward to hearing from you soon.